So complex amalgam restoration criteria. We know that we have 4 points: very good, satisfactory, borderline, and unsatisfactory. And very good is 4, okay, and then satisfactory is 3, borderline is 2, and then unsatisfactory is 1. And then when you go like F, then it's 0. Okay. And so your restoration will be marked in for each point of criteria. For each point of criteria, they will be marked as, so restoration finish, optimum smoothness. So for each point, you'll be marked this. So I think they give for 15 points is 45, and then 23 is passed. That's according to their handbook. But then again, if you look into that global marking system, then it's not static. It's not 23 all the time. So for different batches, it will be different.
Yeah, even it also depends on how many candidates is there and how are they doing that exam. Is it good or bad?
Among that batch, right? Who is coming on that?
Yeah. Okay. So now, first of all, restoration finish, optimum smoothness. So that means that it has to be very smooth, like no void, no nothing. So probably this is a good example. Like there is no, it's optimum smoothness. So there is no bubble, like no surface porosity, no defect. There is nothing. Okay. So this is kind of optimum.
That's very good.
Some areas of surface roughness is still satisfactory. So don't stress too much that you have to do this. This restoration I have done at home with a lot of time. I did not set any time. I just wanted to make that ideal one, just to know that yes, I can do that ideal thing. But then again, I stressed my with time, like I gave myself 45 minutes to finish. Then I could not replicate this one. Okay. So you need to know, you need to at least produce 1 or 2 ideal tasks. Okay. Then you can stress yourself with time and then see how you can manage that. You can come to, if you can, you aim for ideal, but then stress yourself with time and then come to satisfactory.
Okay.
Yeah, in exam situation, always you aim, when you're practicing at home, you aim for ideal, because in exam there is this exam stress, you have time constriction and everything. So if you learn to do ideal, then in exam it will come down to satisfactory. Okay. All right. So we know that so optimum surface smoothness is very good or ideal. Satisfactory is some areas of surface roughness. Borderline is some areas of roughness that requiring correction. Okay. Then we move to next criteria, which is material handling. So material handling, there should not be any cleft or void. Cleft is like, when especially in the tooth restoration junction. So that is a separate criteria altogether. But then in the material also, when we do increments, like when we use one capsule and then use another capsule, there can be it may not merge properly if you don't condense it properly. So on the restoration itself, you can see small void or porosity kind of thing. So it all depends on condensation, how properly you are condensing. If you are doing condensation really well and nice, then you will not have any cleft or porosity on the restoration one itself. Okay. Then that material handling or debris, that comes into our 3D. So no debris, no damage to the gum, no damage to the tooth, assessment tooth and adjacent tooth. That's our 3D for any task. Okay. Restoration in integrity, we already know that it has to be there. Okay. For all 3 restorations. So for amalgam, composite, temporary crown, restoration integrity has to be there. So if you made a good temporary crown, but then you lost it in the suction or on the floor, or you failed. Okay. You made a good amalgam, but at the last moment the whole amalgam came off. The restoration is not there. So what are they going to mark on it? So it's totally failed. Then we talked about our tooth restoration junction overhang. This too comes into, like, if you look into it, what the meaning of it, these two is actually similar. So you can count them as one criteria. Okay, so tooth restoration junction has to be, there should not be any catch. Okay, no excess or over flash on the tooth restoration junction. So how we check it, we run our probe like a zigzag motion. Okay, so you go from sound tooth to sound tooth and the restoration, and again come back. So when you're doing this zigzag, then if there is any excess or flash or any defect, you can catch it. Okay, so tooth restoration junction, there should not be any catch or any defect. So there is a slight catch here, but slight catch, see, junction of the restoration and tooth just detectable by the probe. Okay, so that is just detectable here, so I can actually safely leave it to be satisfactory. But my suggestion is try not to leave any point behind. If you even see there is this slight catch, even your whole amalgam is finished and set, use the wheel and curver, you can scrape it off. The wheel and curver is very sharp, it will scrape it off. Okay,
I think it's the same for the composite as
yeah,
well as the welding curve.
yeah. Then, distinct especially to avoid any point is less than 0.5. See how less the your criteria is from taking you from satisfactory to borderline. So what is less than 0.5? It's very nominal, right? Yeah. So the 0.5 is the tip of this probe. Yeah. So less than 0.5 is even very, very small. Okay, that will take you to borderline. Then overhang is the same, it's only for the proximal box. Okay, this one and this one is the same, so no cervical overhang present, slight cervical overhang just detectable by the floss. So that is only like excess flash that is in the cervical. So these two criteria is actually one criteria. Okay, this one is for the tooth restoration junction of the overall, and this is only for the cervical area, right? Then this two comes with this one, damage to adjacent assessment to damage to gingival. Okay, so that's our 3D. Then for contact we have 3 points actually. So proximal contact tightness, proximal contact contour. So under the contour there is the width and the height. Okay, so tightness and looseness. So we have talked about it when we did the composite. So optimum tightness, what is the optimum tightness? So when you pass the floss, it should make this tuck kind of noise. Okay, and coming out tuck. And loose will be like, so this is good, they're all very good. So for example, this is loose, so there is no contact at all. So we do have to have contact. No contact at all will take you to straight fail. Okay, and it will be a bad fail. Make a contact even if it is loose. Okay, so look, very light or very tight proximal contact is still borderline. Okay, very slight or very tight contact is satisfactory, but very light or very tight contact still is a borderline. But no contact absent, it takes you to unsatisfactory. Okay, then proximal contact contour, we have 2 points under this. Number one is the width. Okay, so what is the width of the contact? So we know that contact is a point, right? We call it contact point. So contact point is 1 millimeter. Okay, so when you pass the floss and then you pull the floss, okay, just optimally, and then you pull it, keep pulling it, and then see the difference between the two floss. See the distance between the two floss.
Let's check with the probe.
So this has to be 1 millimeter. Okay, I'll show you the perfect example. Mesial of this restoration is the proximal, the contact width is perfect, distal is
This is how they check as well.
yeah, distal is broad. Okay, I left it intentionally to show you guys. Okay,
That's very nice.
yeah, so I made it that way, but then I left it. I did not correct it. I could still correct it, but I did not correct it. Just to show you guys. So that's how the width of the contact and height of the contact. That is our positioning of the contact. So we already talked about that. Incisor has incisal 1/3. Premolar is kind of like in between, and then molars is just in the middle. Okay, so if you think that but don't stress too much about on it. like slightly broad contact, slightly occlusally or gingivally placed is still satisfactory. This point is a lot flexible than this point, the contact itself. Okay, then occlusal anatomy, it has to be like resembling that it's a molar. You don't have to stress about the secondary tertiary anatomy, all those tiny little groups. You don't have to replicate. It should have all your gross anatomy, like the cusp tip, cusp positioning, the marginal ridge. All those things needs to look like a premolar or a molar. Okay, then lingual and buccal tooth contour, that's the one I talked about. So tooth restoration maintain original tooth contour. Restoration morphology generally resemble original anatomy. So these two are the same, occlusal anatomy and lingual and buccal contour. So occlusal anatomy is this one. Lingual and buccal contour that I talked about, that you have to have the planes. So the cervical plane and the occlusal plane, you have to replicate that. So you have to replicate this one also here and then here. And then for the upper molar, there is a groove running here. Okay. So then cusp height and cusp positioning, we already talked about it. And marginal ridge height. So marginal ridge height, that is important because for the some of the mannequin, the distal marginal ridge of the 6 and the mesial marginal ridge of the 7, sometimes we find that the mesial marginal ridge of the 7 is lower. Okay, it's very low, it's like more than 1 millimeter low. Okay, but according to our exam criteria, they has to be equal.
Okay, the 6 and 7.
All the marginal, all the ridges. So marginal ridge at the same height at the adjacent marginal ridge. Marginal ridge functional, but slightly above or below adjacent to the marginal ridge. And marginal ridge is discrepancy is less than 0.5. It will take you to borderline. So even though in the mannequin you find that the marginal ridge is very low, you have to bring the 6's marginal ridge to that height as well. Okay, no matter it in the mannequin it is showing that it's very low, but then still you have to use the wheel and curver and go that this motion and this motion, it will come down. Okay, even you can use the bar like the football bar, so just lightly do it,
just to make it.
Yeah, and then after that you can use the enhance to, if it makes it shiny, then use the enhance, it will make it dull. Okay, so that's our amalgam criteria. So all the restoration has some points that are similar, like the composite, the amalgam, and the temporary crown, and it has all of them has their unique criteria. Like the amalgam has to be like the void and surface roughness, and the composite has internal porosity and incremental line. So all those things, but roughly most of the restoration, and also in the mouth, when you are doing for a patient, always think about what you are going to do in a real life scenario, like in a patient. Like this is a simulated patient, this is a, don't think about you are doing it for exam, think about you are doing for a clinical life. Like when you think about when you leave, if you leave a high point for a patient, like the marginal ridge, if it is high, then what will happen? The opposing cusp actually hits the marginal ridge area of the opposing arch. Okay, yeah. If you look into the occlusion, see the cusp that is hitting into the marginal ridge area, right? So what will happen if you leave it high? Then the patient will be, the bite will be high. What will happen if you leave it low? There will be there will be plaque retention. The plaque will always keep getting, and then the bite will not be actually functional bite, right? So we cannot leave those things, like the cervical overhang. If we leave it there, there will be plaque retention area, and then there will be secondary caries and gum problems, right? So think about what you're going to do in a clinical scenario, and then it will be all the criteria will make sense, like why we cannot, why we have to do it that way, right? Then it will be like the criteria will all make sense, fall into their places, and you can replicate it, right? Okay.